is live?
Yes,
Hi, my name's Madison. I'm a nurse practitioner student. How are you today?
I'm good. How are you?
I'm good. Today we're going to be doing an assessment of your chest, lungs, and heart. Is that okay with you?
Yes.
Okay. So, upon inspection of this patient, I see that her shape and size of her chest is very normal. Her AP to lateral diameter is also a normal ratio, being that her lateral is larger than her AP, which is what we like to see. She's breathing very easy. She appears to have a normal respiratory rate and respiratory rhythm. No accessory muscles are used. She's breathing just as we would hope for a patient to be breathing. Now I'm going to palpate your I always forget this word. Suprasternal notch.
That's a lot of words.
I know. And your angle of Louis. And then I'm going to palpate your trachea. And it is in fact midline, which is what we like to see. All right, if you don't mind, I'm going to have you spin around so I can examine your lungs and posteriorly and laterally. All right, so I'm going to have you in here in a second. Take a big deep breath for me. Good. Now my hands move symmetrically, which is what we like to see. If my hands moved non-symmetrically, it would lead to a further concern of some type of issue. So now I'm just going to palpate and feel for any crevice. Can you lift your arms for me? Perfect. There's no crevice. Upon palpation, go ahead and put your arms down for me. All right. Now I'm going to do the tactile firmness test. I'm going to have you say 99 over and over, and I'm going to feel for the vibrations in your back. Okay, go ahead.
99, 99, 99, 99, 99,
And lift up your arms for me.
99.
Good. Go ahead and put them back down. All right, now I am going to take a listen to your lungs posteriorly and laterally using the diaphragm. All right, just take a big deep breath for me. And out. And again. And out. And again. And okay. And out. One more time. All right, now I'm going to give you a second to catch your breath, and then I will listen to your lungs on the lateral sides. Just let me know when you're ready.
I'm ready.
Okay. All right, can you lift your arm for me? All right, go ahead and take a deep breath. And out. Okay. And out. And again. And out. And out. Okay. Listen on the other side. Good. Go ahead and put your arms down. Now I am going to percuss the back. All right. And lift up your arm, please. Okay. Now I'm going to do one more test on your back, and then I'm going to have you lay in a supine position, and we will move locations at that point. Gonna do the same thing again. Can you take a deep breath in and hold your breath? Good. Kind of make a mark in your shirt on this side. Go ahead and breathe out. Alright, now take a big deep breath in. Alright, now I'm gonna give you a second, and then I'm gonna have you not take any breaths in while I do this side. You ready?
Your dad's standing there.
Mm-hmm. Going to measure on this side creases, which is about 3 centimeters. Then I'm going to, just don't breathe out again. Just measure one. Good, also 3 centimeters, which is normal. All right, and last but not least, I'm gonna do a vocal resonance assessment. Basically, I'm going to have you say 99 again, but instead of feeling, I'm going to listen in the areas that I previously found. Okay, go ahead.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99,
And lift up your arm. Again.
99,
And one more time.
99.
Okay, perfect. That was about all of the lateral and posterior assessment that I'm going to do. So at this time, I'm going to have her lay into a supine position, and then we'll do her anterior chest and lungs, and then her heart assessment. So now I'm going to continue the assessment with the patient in a supine position so that I can palpate and auscultate her lungs and chest anteriorly. So I'm going to take a listen. Deep breath in. And out. Okay. And out. And now I'm just going to feel here anteriorly for any crepitus. And there is none. Good. Now I'm going to begin the heart assessment. So I'm going to start out with an inspection of the precordium. I'm going to take a light and just look at it tangibly. I'm noting her apex, her sternal borders on the left and right, and her sternum. There are no pulsations, heaves, or lifts noted, which is what we expect to see. I'm also going to palpate the precordium, so I'm going to palpate the apex, her left sternal border, her right sternal border, and then the sternum. Good. Now I'm going to palpate for your apical pulse. Which is found at the left fifth rib midline. And there there are no pulsations, heaves, or lifts there at all either. I'm going to palpate as well for any thrills. Okay. So now I'm going to begin auscultating the heart. I'm going to start out with using my diaphragm just to listen to any heart sounds. Going to start at the aortic. The pulmonic. Herb's point. Tricuspid. And mitral. S1 and S2 heart sounds are heard. There are no S3 or S4 sounds noted. Now I'm going to listen to the same spots, but I'm going to ask you to hold your breath this time. So let me know when you're ready. Go ahead and breathe out. There was no splitting noted when doing that. And then I'm going to listen to those same 5 spots again, but I'm going to do it with the bell of my stethoscope, which will let me know if there are any murmurs. Upon auscultation with the bell of my stethoscope, there were no murmurs noted. Do you have any questions for me?
I do.
All right. Well, thank you for your time. That concludes my assessment.
Thanks.